At NJ-HITEC, our only product is a satisfied doctor. In the beginning, it was just nothing more than a dream in somebody's mind. The idea was to embrace the doctors wherever we found them and to invigorate them and to energize them to become members of the health information technology community.
We have a number of providers that already have electronic medical records. We have those that are just starting and need the extra help. And NJ-HITEC has really been a major supporter of ours to help us to really get to this broad number of physicians from all different levels of knowledge with information technology.
We had just started to think about meaningful use. And initially, we found the application process very cumbersome and difficult to understand.
We had someone from NJ-HITEC in the office that explained to us what was expected, making sure that we were sort of up to par with the meaningful use process.
They were helpful on site, via phone, via email, and basically walked us every step of the way.
Healthcare is information intensive. So the better we can help our providers to manage, access, and use that information, the better they can treat their patients and their families.
The reality is that for doctors to use electronic health records is simply a better way to deliver health care all over the country and all over the world to their patients.
Before we had the paper-based system, and it was the best technology that we had, it wasn't good enough. It was disjointed, and it led to a lot of gaps in the system and to a lot of gaps in service.
Health IT is very much like the central nervous system of the human body. You need to bring in a lot of data to a central location so that decisions can be made logically, they can be made in the patient's best interest at a cost-efficient way.
NJ-HITEC is the direct liaison between the federal and state agencies that are involved with health IT. All the updates and all the mandates that are out there come hot off the press directly to NJ-HITEC. We simplify the information provided to the doctors so they can meet their health IT objectives.
And every day we have team members going out to doctors' offices, consulting with doctors.
We teach them not only to collect the data, we teach them to understand the data and to use the data for practice transformation, but more importantly, for improving patient outcomes. We work with primary care providers. We also work with hospitals. We work with specialists. We work with consortiums. We work with the federally qualified health centers.
Trying to formulate the development of health information organizations that will sit between doctors' offices and the hospitals or the laboratories or the state public health records.
And having this central nervous system that brings all this information together really makes it much better for the patient from a quality perspective.
I think EMRs have been fantastic too from a reimbursement and a payment standpoint. So when a patient comes in, the receptionist is aware of payment history, is aware of any outstanding balances, whether or not we have active insurance information on a patient. All of those things that once were more difficult to capture now happen almost immediately electronically.
The clinical documentation drives the billing, so that certainly reduces any potential for abuse. It's a far more efficient system, which results in us getting paid quicker.
Privacy and security is a lifelong, ongoing commitment for a doctor. And as a result, every stage of meaningful use has more and more rigorous obligations. We are here every day to help providers stay fully compliant with their obligations as to privacy and security.
The end result in this whole thing is improving patient care.
What NJ-HITEC did for us, not only did it prepare us for meaningful use, but I think it created a lifestyle and a culture in our office that's something that's going to be a lifelong proposition.
The beauty of the electronic clinical record and the beauty of working with NJ-HITEC, it allows us to provide a better service to our patients. They get better, they get healthier, they're better able to work, they're better able to have a life.